Hi there. India has recently crossed the 900 million vaccination mark. However, that means that more than half of the population is still to be vaccinated. With daily cases now hovering around the 30,000 mark, how can we interpret India's current situation when it comes to COVID 19? Has coronavirus now turned into an endemic, as been suggested by various experts? Or is it the lull before the storm? A sense of deja vu prevails. I remember February was similar. It was a similar state of mind for Indians. And then came the catastrophic second wave. So, ahead of the festive season, we asked the big question: is a third wave impending and are we prepared? Today, we have a very eminent panel of public health experts with us to help us understand and decipher the current scenario for us in terms of cases, the vaccination coverage, and the much touted, much eminent third wave. I welcome on the show today Dr. Raj Shankar Ghosh. He's a senior advisor, Vaccine Delivery, Bill and Melinda Gates Foundation. Dr. Anant Bhan, he's a researcher, global health, bioethics, and health policy. Dr. Ratna Devi, she's the chair of Board of Trustees, International Alliances of Patient Organization. Thank you so much, all of you, for participating in this conversation. So let's begin with our vaccination coverage. It's an incredible number that we've achieved in the last couple of months after a very, very rocky start. So I want to come to you, Dr. Ghosh, to understand your view of India's current vaccination coverage and how long is it going to take us for us to achieve uh, the the number or the 100% vaccination coverage figure? Do you think the December deadline that's been set by the government is like a distant dream right now?
Thank you. So first of all, as we all know, the story of vaccination, we have a very interesting acronym for that. It's called a SAD acronym. SAD means supply, access, and demand. The vaccination program will depend ultimately on what is the supply of the vaccine, what is the availability or the accessibility of the vaccine to the population, and ultimately what is the demand by the population for the vaccine. As you know that over the past few weeks, we have seen incredible coverage in India. The interesting part is that in almost all the states that are of large size, Uttar Pradesh, Madhya Pradesh, Bihar, Rajasthan, Gujarat, and the southern states, there is more than 90% utilization of the vaccine that has come. The program, as we understand, started with targeting the vulnerable population amongst the health workers and the frontline workers. Almost 99%, as per the CoWIN data, have received at least one dose of the vaccine, and more than 80% of them have received full immunization. Given this figure that there is an increase in the coverage which is happening, if we are able to keep the supply up, and at this point of time, the Serum Institute supply has stabilized. The Bharat Biotech supply is also sort of slowly gearing up. And the other vaccine which is being used in the private sector is the Sputnik vaccine. And there is a much room for improvement of that supply. There is a fair amount of supply stability that is coming. To answer your specific question, whether we will reach by the end of the year, we will keep our fingers crossed. Perhaps in the first quarter of 2022, we will have a very large cohort of vaccinated population in India, which will give rise to what we call as herd immunity amongst the larger population.
Okay, understood. Dr. Bhan, I want to come to you. How do you perceive the current scenario? We understand where we are in the vaccine situation. What about the current scenario when it comes to the infection spread? Is the worst over, considering the cases are now below the 30,000 mark and it's not seeing any surge in the recent past in the last 1 month or so?
Thank you, Vartika. Thanks for having me, and a pleasure to be on the panel. So, as you're rightly saying, we seem to be certainly in a relatively much better space than we were earlier in the year, given the second wave was fairly catastrophic, as all of us know. Almost all of us have been impacted in some way or the other, family, friends, colleagues, sometimes lost or at least have had to be hospitalized, sometimes with difficulty in accessing even basic medical requirements, etc. But fortunately, we've passed that, and all thanks to all the hard work done by the health system, our frontline health workers. The government certainly played a role, but also did civil society and many other stakeholders. Right now, I think we are certainly in a fairly good space, as you were rightly pointing out. Of course, it's not the case that we are having very low numbers. The numbers remain hovering around the 30,000 per day mark, as you're talking about. But that is much better than earlier, and it is much better than many other countries. That having been said, we are also heading now into the festive season. Unfortunately, it's also the case that adherence to public health measures has certainly gone down. And this is not new. It happened actually last year as well, if you will remember, after the first wave. And we were fortunate that the second wave actually did not start immediately, but it actually petered up and picked up pace much later. But that having been said, now that with the festive season coming up, a lot of family events, it's likely that there will be more possibilities of exposure. Also, with schools, colleges opening up, more and more offices reverting now to going back to a pre-pandemic style of functioning, markets where people don't necessarily wear masks, and generally people getting more and more casual because perhaps they don't fear COVID in the same way that they feared again. That's where I think there is a cause for worry. Now, the saving grace, as Dr. Ghosh was rightly pointing out, is the increasing vaccination and the coverage that we are seeing in the population. And that we've seen across the world is certainly a major protective factor in terms of helping us ameliorate any possibilities of a third wave or a severe third wave. So it's likely that and we are all hoping that we will not see a major third wave. We might see blips, we might see certain upward trends, and that is actually already the case in some states, right? We've seen some states where cases continue to remain on the upward side as compared to the rest of India.
So ICMR has shown some worry, especially regarding the revenge tourism, as they call it, that can be the trigger for the third wave. And they say that the cases may go up by 47%. Dr. Ratna Devi, how do you perceive this? How real are the concerns of the third wave? Though Dr. Bhan has just touched upon the point, but how do you see it coming, and how severe would it be if we foresee one?
Thank you, Vartika. And I just agree with both the panelists that while caution is the name of the game, there is a festive season around the corner. And as you rightly said, with the revenge tourism and people going out because they are fed up of working from home, or people getting into the holiday season because we are just 2 months short of the big holiday season. So people moving out and venturing out might enhance risky behaviors, meaning not, the COVID-19 appropriate behaviors in terms of masking, hand washing, social distancing, etc. And that will definitely lead to increase in cases. But whether that can be termed as a third wave or not is something that we will have to wait and watch.
So we understand that, globally and India too, there has been this sense of overconfidence, especially among the youth, that they have this falsely presumed invulnerability regarding COVID-19. So Dr. Bhan, help me understand, what do you think is a bigger challenge in India achieving its vaccination figure? Because that's very important for us to counter or fight the battle in the longer term. Is it vaccine hesitancy or the vaccine supply?
Sure. So, I mean, that's a very good question. And I think we have to realize some degree of nuance in the way we think about these issues. And the reason I say that is when we use the term vaccine hesitancy, sometimes it ends up being a very blanket term. And we don't realize that, behind the hesitancy, there's a whole list of factors. There's some people who had legitimate concerns about the vaccines early on when they were just launched, because perhaps there was not adequate information and or data in the public domain. Then we've had now extensive experience over the past many months with millions of doses being given out. We all know that these are fairly safe vaccines and seem to be fairly protective as well. Of course, one still waits for the data to be published in the public domain. So on the science and the safety and efficacy part, perhaps there are lesser concerns. What we certainly need to worry about, though, including both in sort of the urban young, as you were rightly saying, but also our rural population, is misinformation. Is rumors which are spread about the vaccines, that the vaccines are there to harm you, the vaccines don't work, the vaccines will cause some other disease, or for example, many of you would have heard of rumors around menstruating women should not take vaccines, or the vaccines are a ploy to do X or Y, right? And that's the kind of misinformation which needs to be responded to.
Dr. Ratna Devi, I want to come to you. So as we are staring at a third wave, which may or may not come. There are these reports of schools reopening across the country, though we feel that it is high time and it is a big necessity. But do you think that the risks outweigh the benefits out of it, or we still be sure that our kids are going to be safe when they go back to school, considering the vaccine for kids is still not in India?
Okay, so I will reinforce what Dr. Raj keeps saying all the time, that it is not the vaccine that's going to save us, but it is the behavior. And schools are supposed to be responsible institutions. So we are hoping that whichever school opens up will also instill that responsible behavior in the children, as well as the parents who are sending those children to the schools will also instill that responsible behavior in the children. So schools are also experimenting to see how best to protect the children, because it is also in their interest that the children are not sick. Because the whole purpose of bringing the children to school is to enhance their learning process, not to make them sick. So a lot of these schools are now going to, learn from their experiences of how they are managing the children who are coming back to school. However, the problem for rural schools still remains, where the space may be a constraint. Because many schools don't have, buildings big enough or space enough to have the social distancing norms. And it is in those schools that the challenge will remain as to how to keep the children separate from each other, or during play hours to see that their masks are still there, because it's kind of hard to play football with a mask on, so how do you ensure that kind of behavior while allowing the children to have the freedom to be able to do what children are meant to do? So I would say that the benefits, especially of mental health, far outweigh the risk of bringing the children to school and getting them infected.
Coming back to you, Dr. Ghosh, regarding inclusivity in the vaccine coverage, we see there's a 12% gender gap in vaccination drive in India. Are women really reluctant to come out and get vaccinated, or are they being deprived of the opportunity to come out and get vaccinated?
Gender inequity is a problem not only in case of immunization, but in general, the primary healthcare delivery mechanism in the country. In our routine immunization services, however, we do not see much difference in terms of the coverage with the boys and the girls. Having said that, I will say that there are geographic pockets of inequity. There are inequities in terms of the various social structure that are there in our country. In case of COVID vaccination, some states, particularly Uttar Pradesh, Bihar, which were very much aware of this entire gender inequity issue, they took some steps. For example, Uttar Pradesh carried out these pink booths, which were dedicated to women. There was a special drive which was done in Bihar on behalf of the government in order to encourage women to come to specific areas where there were specific dates. A huge campaign was done within the community to ensure through the ashas that the female population is identified, they are verified whether they are vaccinated or not. In the Northeast, where we have much of the matriarchal society and all of that, we have seen a lot of the movement in terms of the women getting a large number of the vaccination. But you are very right. There is a lot of improvement that needs to happen in terms of the gender inequity. There are states where we have seen the gaps. The best part of it, is that there is a very robust analysis of this being done by the Immunization Technical Support Unit, which is the technical arm of the Immunization Division. And almost every week, the data is generated and letters go from the central government to the state government to take action on these gender inequities that is there. On the wealth inequity, the educational part, and the gender, these are the three factors based on which we see that there is an inequity in immunization. But steps are being taken by the states.
Thank you, Dr. Ghosh. Thank you, everyone. I think this was a very delightful and insightful conversation from on a very, very important topic and much required and timely. Thank you so much. I just want to close with your final comments of the situation. What's the road ahead for us?
I think that, there are, I keep on saying this, that there are 3 E's that we really need to keep in mind moving forward. We have always focused on equity. We have, focused on our excellence in terms of delivery. But the one thing that we have learned from COVID vaccination is that whatever policy, whatever planning we do, it needs to be done with empathy. So therefore, the empathy part of it, we really need to keep in mind, because we saw the suffering of the marginalized population, of the migrant population. So therefore, as we move forward towards our planning, we will have to keep equity, efficiency, and empathy in our mind in planning and policies. Over.
Yes. Dr. Bhan, over to you.
Sure. So, I would really want our audience to reflect over the experience of the last many months. And, all of us are important stakeholders. We vote for our politicians. Reflect on what this whole experience means for you, your families, your loved ones, your colleagues. And why is it that health is not a political issue? Why is it that we don't demand of our politicians that there be a more robust health system which is able to cater to the needs of our population? So when we move ahead in all our, elections at any level, if we can demand of our policymakers that they put health and in fact other social services at the center of what they campaign for and make them accountable against that, that I think is what we should be looking forward to. Because, pandemics will come again, with more human-animal interactions, with climate change. This is not the last one which will probably hit us. But the more important issue for all of us is how are we going to prepare ourselves for the next challenge from a health perspective. And for that, of course, we need a much more resilient and well-resourced health system.
You're responsible for your own health, because we know that people with comorbidities suffered the most. And, while all our healthcare providers, policymakers, everybody has been talking about Fit India, Swasth India, etc., people had a lot of apathy towards their own health. They never went for health checkups. They did not follow doctors' orders. They never went for any exercises and other stuff. But this pandemic has taught them, or the general population, that if you're not responsible for your own health, then when you're in a crisis, even the best healthcare system cannot save you.
Absolutely, absolutely. I mean, empathy and compassion are two important words that we take away from 2020-21 as we step on to 2022 after 3 months or so. Thank you so much, all of you, for joining us in this delightful conversation. Thank you so much. Bye-bye.
It was a pleasure. Thank you.
Thank you so much.